are so many numbers that come at us every day about COVID-19. It's easy to get confused and left wondering what it all means. And Tuesday's testing delay spike in Allegheny County is a prime example of that. But it doesn't mean a lot more people are sick, as we learned yesterday. New this morning, John Shumway joins us for some perspective on all of this. And John, really, when that number came out yesterday, we could hear it in the newsroom. Oh no.
Yeah.
And then you start reading a little bit more into it.
Yeah, we're talking, the system's not perfect.
Right.
But they're doing the best they can. But we found out yesterday what the lag can do. And in fact, there were reported 331 new cases yesterday. Well, those dated all the way back to June the 8th. In reality, there were 186 of those cases actually were delayed from back then. Only 145 was the real number for yesterday, which is far better than what we did last week. The positive cases, which are reflected in the Allegheny County Interactive website, go all the way back to the beginning of the pandemic. So what do you do with all this information? I put that question to the chairman of the Allegheny County Board of Health, Dr. Lee Harrison.
I think it's great that we have very specific neighborhood level data on COVID cases. But in reality, we know that the virus is widely circulating in this region, and we should assume, that basically we have COVID in our communities, and therefore the same precautions that we always take for COVID should apply, basically.
Doc, I think a lot of people just want to see this over. When's that going to happen?
So clearly, we need a vaccine, and it's hard to predict when we'll have a vaccine. But if it's a safe and effective vaccine and the majority of the a large proportion of the population gets vaccinated, that will, could be the beginning of the end. So it's hard to say, but we've got a ways to go. Let's put it that way.
Dr. Harrison, I appreciate your insight and your time this morning.
My pleasure. Good to be with you.
Yeah, and Dr. Harrison points out the CDC estimates that for every case that is diagnosed, there are probably 10 out there that go undiagnosed. So you've got a lot of information and the breakdown of numbers. And what the health professionals say it all points to is we all still need to be cautious with the mask, with the sanitizing, with the social distancing, and take it all with a grain of salt when you hear these numbers.
Well, right. And we expect, as we do every day at 11 a.m., that we will get those new numbers today. But I think it's just important that we look at all of the information that's coming out line by line to see what exactly this means.
Yeah, ignore that 331 yesterday. The number you should remember from yesterday is 145.
Yeah, exactly. All right.